Hello, this is Dr. Lewerenz at Longevity Health Institute in Rochester Hills, Michigan. Here we do functional personalized medicine, and as most of you already know, we do a lot of hormone replacement. It's one of our 6 main steps in optimizing wellness and prevention and function. And I want to discuss with you today a type of hormone replacement, a method called testosterone and/or hormone pellet replacement therapy. Pellet therapy, pellet insertion therapy, if you will, is very simple. It's a way of inserting a little, almost tic-tac sized hormone under the skin, particularly usually in anything subcutaneous fat, like typically we use around your hip, but we can place it in anything that's in your subcutaneous fat. And actually, particularly testosterone in women and in men, we can optimize levels that really have strong, efficient benefits, very efficacious for things like energy, muscle building, bone building, libido, vitality, mood, and literally what you hear me say a lot is thriving, not just surviving. In fact, when we optimize testosterone, even in a woman, a lot of wonderful benefits happen, even related to mood and quality and benefit of life. So commonly, we'll do testing either in laboratory serum or in someone's saliva, and we'll discover, typically not on one test, but on maybe 2 or 3 different times of the day testing, or a tissue level like a saliva test, we will discover if somebody has low or suboptimal testosterone. And if they do, they often will accompany symptoms like myalgias, muscle aches, body aches, fatigue, no kind of stimulus or excitement to the things they used to enjoy, so kind of like an apathy or depression, very commonly fatigue, and very commonly things that they used to enjoy, like exercise and sports and events, and things that used to really stimulate them and provide a lot of happiness and good things in their life, they really struggle to do. In fact, actually today I had a woman in her early 50s that actually was explaining to me not only has her libido gone down, her sex drive has gone down, but that she really wants to train and work out and go to the gym. She has her whole life. Was a fitness instructor, a Pilates instructor, and she just the last several years after menopause has just lost that vigor for exercise and outdoor activities and being active. And that has a lot to do with testosterone. So again, you don't need a super physiologic level, but you need an optimal level. So often, just like in a man, we'll optimize testosterone, again, using a small tic-tac. It's in here, it's sterile, so it's kept in these vials. We'll use a dose, and it's a very conservative dose, typically in a woman about 50 milligrams to maybe at maximum 100 milligrams. They're injected sterilely into the hip, or again, some subcutaneous fat. And in a woman, again, that 50 to 100 milligrams can really optimize their levels and give them that vigor. Now, one thing that I notice in women, and that is very impressive, not only do they get better libido, not only do they get better energy and feel a much bigger, more natural, like they used to drive for exercise, but if this person was used to athletics, sports, outdoor activities, being physical, gardening, hands work, things like this, when they're in their 20s and 30s, typically they have a testosterone or hormone receptor activity where that testosterone hormone hits the receptor. Typically they're used to higher ranges, higher levels. So when we do testosterone replacement in a woman to get those more optimal, optimal levels, they really feel like they did when they were 30. And there is nothing but supportive evidence on the benefits, even again, muscle, metabolism, mood, sex, and energy effects. There's even a few small studies that show that testosterone replacement in a woman is breast cancer protective. And that's, what can you say about that? Anything that's protective against breast cancer in this epidemic that we see now all the time around us is amazing. So the other thing is too, is that often the question is, well, why don't you do oral testosterone, or why don't you do these troches they're called, or why don't you do creams? Well, they're not the preferred method here at Longevity Health Institute because one, you don't get full absorption. Testosterone in a cream, it can be absorbable, but usually it is a bigger molecule. It's harder to drive through the skin, and people don't get the same effects. Also, you can convert to what's called dihydrotestosterone, and dihydrotestosterone can cause hair loss and or unpreferred hair growth. Also, you can get more conversion to estrogen. So testosterone on the skin can also even convert more to estrogen, okay? And that is always a possibility. So they don't get the full benefits, okay? When you do something sub-Q into the skin, you take away those conversions typically, and you just get the full testosterone benefit. And this also goes for a man. Now, men's dosing obviously are different. The pellets itself, usually we use anywhere from 3 to 5 of these that are like a Tic Tac size and shape. And again, these last about 3-4 months. Obviously, everyone's a little bit different. We draw labs. It's a personalized approach. It's always a hormonal balanced approach. It's not one hormone to give you this ultimate effect and not in a balanced way. You're always going to be safe and balanced here and looked at in a very personalized way. But I will tell you the evidence, we do probably 3 to 5 subcutaneous pellets placement myself and my practitioners here a day. They're very, very effective. Patients are thrilled, very satisfied with them, heal very quickly, couple days in the hip, and they have 3-4 months of nothing but good results. So something you want to consider, especially if you've been the person that in your life you have been very active, had a higher sex drive, had some decent muscle and physical energy, used to play sports or work out in your 20s, 30s, even early 40s, and if you got into perimenopause or menopause and you've actually lost that drive and that feeling and that good mood and that, if you will, high from exercise and physical outdoor activity. And this goes without saying, the same for men. Men a little bit more obvious because they'll have symptoms of lower libido and really bad mood and real significant fatigue, and usually will catch their levels in the lower quartile or suboptimal. So this is a preferred nice method, of hormone replacement. We can use pellets for other hormones, but typically we use testosterone mostly. But again, it's always a balanced, personalized approach. So hopefully this is insightful, gives you some introspection into testosterone and hormone pellet replacement and insertion. Again, very safe, very effective, patients thrilled, and we're happy to bring it to you. So hope this finds you well. Hope this is insightful. If you suffer from any of these conditions, come see us at Longevity Health Institute. Me and my other practitioners do hormone replacement every day. It's part of our 6-point model to bring you the best in health and wellness and personalized medicine. Be well, Dr. Lewerenz.